You'll have to keep everyone entertained, do some goofy looks or something, send out hearts. I don't know, just to like, keep everyone engaged.
What is it, the seventh inning stretch? Just get up and start doing some exercise.
Welcome to the Margo Show. I'm your host this afternoon, Ingrid Levin. Margo is out on assignment. Today we have a really special guest, Dr. Gary Linkov. He is the founder and medical director of City Facial Plastics on Madison Avenue, New York City. And today we're doing something different as well. We are live on Instagram, so we're going to be taking questions from the doctor's followers. So just wanted to ask you some great questions that we all have top of our minds. What is the approach to facial plastics?
Well, thanks so much, Ingrid. So good to be here with you today. Thanks to Margo for the invitation to be on her show. So I'm a facial plastic surgeon and hair restoration surgeon. So I do both surgical and non-surgical procedures for the face, neck, and hair. That's the only thing that I deal with. So my overall approach is just to create a very natural look. I don't like anything that's overdone. And I want people, after they leave my office, to have others tell them that they look refreshed, that they look just good and rested. I don't want them to be able to guess what procedure that they had or that they had anything done at all. That's always the goal in the back of my mind. And usually patients who have a similar goal tend to find me. If they want very extravagant results, they usually aren't coming to me. So very kind of natural, normal looking, but kind of proper enhancement is my overall strategy and goal for my patients.
Yeah, there's nothing like a well-rested look. That's definitely always what I'm looking for myself. So what are the latest advancements and procedures that you're seeing?
Yeah, so there's a new Botox on the market. It's called Jeuveau, and it's the same type of molecule that is in Botox, but it's made in the state-of-the-art factory in South Korea, actually. So it's just brand new, just FDA approved as of a couple of months ago. They have clinical trials to back up their latest neurotoxin. So I was one of the first practices that they asked to try it out and see, if it really does lead to similar results as Botox. And there's even some suggestion of it lasting a little bit longer than most other types of neuromodulators on the market today. So instead of 3 months, it might last 4 months. But again, we're seeing if that really pans out as more people start using it and receiving it. But again, just kind of the latest, greatest thing. It goes by #NewTox, but it's called Jeuveau. It's from a company called Evolus. So I just started using it a few weeks ago, and so far patients have been very happy with the results. So that's one sort of latest trend that I've jumped on board with. Another one is this machine called the jet peel. It's a way of introducing really any kind of liquid that you might want to use for like a facial, different vitamins, different serums, but also PRP. So you can introduce it without actually touching the skin, which is very interesting. And the studies, it's from an Israeli company, and it shows that it can go to a depth of 4 millimeters. So I'm starting a research study looking at using jet peel as a delivery mechanism for scalp PRP. So people who want more hair and have been getting all the needle injections, which I currently do, but they're just tired of going through the discomfort of that, of getting numbed up and then getting the injections, and then it's a bit of a mess when they leave the office. This is literally no downtime. So we're testing it to see if it's as effective as the needling for the scalp, And it can also be used for the face as part of like almost like a vampire facial, but without the vampire aspect to it. There's no blood. There's a blood draw, but then on the face, it's all left very clean. And you can use the same machine to actually exfoliate the skin before you introduce the PRP. So the PRP adapter is brand new on the market. There aren't too many offices, especially in New York City, that have it. But the actual machine is about 8 years old now, and so it's been used around the world with high success rates. So that's another advance that's more for, again, non-surgical. On the surgical side, I'm doing a lot of upper lip lifts, and I call my technique the Elelyft, E-L-E-L-Y-F-T. So I've in the process of kind of trademarking that name because I've modified the procedure a bit. And what's nice, it's kind of like almost the opposite of getting lip fillers. People get lip fillers and it tends to project the lip out and bring it down. But the lip lift does is that it shortens this portion, the philtrum of the upper lip, and it brings the lip up and rolls it back. So you have more of the red lip showing. You have more of the upper teeth exposed, which is kind of a more youthful look. And it's one small scar underneath the base of the nose, basically, that eventually becomes barely perceptible over time. So it is a surgical procedure, but it's becoming more and more popular as people realize that fillers in the lips just aren't really giving them what they were hoping for.
Yeah, I guess you have to continuously do the lip augmentation every, not the lip augmentation, but the fillers every 4 months to get results, and then it's very costly as well.
It's exactly right. It's costly, but it also produces scar tissue, and I've started the discussion about this, not because, I want to, kind of degrade the use of filler in the lips. There are plenty of people who use it with good results, but what is important for patients to realize is that if you are getting this procedure every 4 months, say, every time you go into the lip with a needle or even a cannula, you're causing some degree of scar tissue to build. So what I'm seeing in certain patients, especially in their 40s who've had filler injections for like 10 years now, is that they've built up scar tissue in their upper lip. And sometimes there's migration of that filler that kind of heads superiorly north, and it just doesn't look very natural. And that scar tissue then becomes permanent.
Oh, wow.
So it's just something to keep in mind. It's not totally benign going in, and forget about just the discomfort of getting needles in the lips that often, but also the actual scar tissue that builds up. It's just something important to realize when you're weighing that versus sort of one incision that's one and done. And for the surgical incision, there are many things that can be done, such as laser resurfacing, to really blend that scar in very nicely, so it's very almost imperceptible.
And how much is the procedure? So
in my practice, it's $3,300 for the surgical procedure. It's done under local anesthesia, so I just give patients basically Tylenol when they come in, an antibiotic, and usually a steroid regimen too for a couple of days to keep the inflammation down. It takes about an hour and a half, and you can go home on your own too, so you don't really even need to come in with anyone. So it's a very easy process for patients.
That is less effective, that is less costly than the actual lip filler. Lip fillers could cost anywhere between 4 to 6, and it only lasts for 3 or 4 months. So definitely, it's better pricing.
It's just it's something exactly. It's just something
pillow lips results.
Right. It's something to consider, and it's permanent, and it's very customizable for patients. And one common question that I get is, well, what if you've had filler? Can you still get? Yes, you can get the procedure. For some of my patients, I have to actually dissolve their filler before I can fully assess the length of the philtrum, because the length, in addition to a couple of other factors, are very important for me to size up how much skin am I actually going to be removing, because it is a more permanent solution. So I don't want to remove too little, and then someone needs a revision, too quickly. And then if I remove too much skin, then that can be a problem too. So it's always about juggling different variables. So sometimes we dissolve the filler, and then the patients come back after about 2 weeks, and then I can fully assess it and then schedule them for the procedure.
Yeah, I like that conservative approach. Sometimes doctors tend to really go above and beyond initially and not take the proper initial steps that are slow
Right.
and which less. You see how everyone's body's different and
Yeah.
face as well. So I wanted to ask you
Right.
as well, what is the eye lift?
The Ella lift? Yeah, so that's my version of the lip lift. So exactly that. So it's making what's called, some people will call it a bullhorn incision,
Right.
because once you outline it under the nose, it almost looks like bullhorns. And the actual like shape and design of it is customized to the individual. So it's all based on the shape and size of the mouth and the lips, and also the base of the nose. So you take a bunch of variables into consideration to design the lip lift or the Ella lift in my practice.
And what do you suggest is the age?
Age range is very broad. So the youngest patient that I've operated on is 22, and the oldest at this point is 61. So a pretty broad range, because in some patients it's a congenital anatomical, not really a problem. It's just the way that they were born, the way they developed. It's nothing that really happened over time. It's just it's always been that way. They've had a longer distance there, and then after you do the procedure, it kind of brings everything more into harmony. And then some patients who are a little bit older, basically age causes a descent and an elongation of that philtrum, just like the skin descends in other areas of the face. So too it does in the upper lip. And so just some people will get longer in that area over time, so we can do this procedure, sometimes even in combination with other aging phase procedures such as a facelift.
Fantastic to know. Now, the hair restoration, what are the sciences? What are you seeing? What's commonplace in your practice right now?
So for hair, we deal with men and women, and that's really important to point out because the needs can sometimes be very different. Most of the patients who are getting transplants tend to be men. We do hair transplants on women, but sometimes the needs are different, so there's more of an investigation for our female patients into what is causing the hair loss. So a lot of them come in, they don't necessarily even want or expect a hair transplant, but they're just trying to figure out, like, why am I losing hair? Why is it shedding? What's going on? And so we actually do a pretty in-depth investigation into that, everything from blood work to we have the special microscope that we can look into the root of the hairs and really try to figure out which pattern it goes with, and then best advise what the next steps are. And oftentimes the answer is not a transplant, but different vitamins, different types of maybe even PRP. Sometimes we have this one procedure called scalp micropigmentation, little pigments to try to create, basically reduce the contrast between a lighter scalp and darker hair. So little tiny pigmented spots that are placed to replicate the illusion of hair. So that's a procedure that we offer some of our patients. And then sometimes steroid injections to reduce inflammation. We'll occasionally do even a biopsy of the area if we're trying to rule out certain types of alopecia conditions. So that's what we're seeing. We're seeing men who really want the more traditional kind of transplant, and women who just are trying to figure out what is going on. And we're doing a lot of eyebrow transplants, so that's becoming very popular in my practice. And I work with Dr. Jeffrey Epstein, and he actually taught me all of the hair work that I do. He's one of the leading transplant surgeons in the country, and so I'm his associate. We're doing a lot of eyebrow transplants from the back of the hair to the eyebrows to give it that three-dimensional volume.
That's just incredible, because the first thing people go to is a dermatologist when they're encountering alopecia based on stress. I mean, there's so many different factors. It's fantastic that you actually go through all the initial steps to get there. It's not just so aggressive at the beginning.
Right.
Are you finding that that there's other non-surgical treatments available for people that, especially men that don't want to undergo? Women tend to like to go and get the treatments, but men, anything to do with needles, they're just
For sure. Yeah, so basically needleless, so now we have that PRP, which is needleless, which is really cool. So we're doing that investigation. That's an option for men who don't want any needles.
Sure.
But if they don't even want a blood draw, options for them would be something like, well, we always talk to them about Rogaine or minoxidil, which is a cream foam type of consistency that you would rub onto the area that's thinning twice a day. It has moderate effect. All the medical treatments have some moderate improvement, but it's not really going to make a huge change. We definitely believe in finasteride or Propecia. It's 100% an effective pill that you take once a day, but it does have some side effects. So we talk to all of our patients about that, and some decide that's not for me. But the side effect, the risks are very low for the most part. So that works well. The other option is a cap. It's a laser light cap that it's like a one-time purchase. You have it at home. You use it 3 times a week, 15 minutes at a time. And it's not just for men, it's for women too. And it just stimulates the hair follicles to grow and become a little bit more dense. And that's also been an effective treatment. And most of our patients are very happy with that as well. So those are some of the options. And the vitamins too. We talk to them about different vitamins, especially biotin-based vitamins that can help strengthen the hair. Those are all options that are completely non-surgical, non-procedural.
Yeah, I've tried the biotin. I took like 1,000 milligrams and I broke out. So go figure. So sometimes, or the collagen, I find that Viviscal.
Viviscal
works.
we like a lot, and that's been studied. There have been research studies that show about a 10 to 15% improvement in many patients. So Viviscal, there's Viviscal Professional too, and that one has like a marine complex, which is also thought to like shark cartilage, which is also supposed to strengthen the hair. And then Nutrafol we like for men. So that's usually the breakdown for vitamins.
So you mentioned PRP for hair growth. Now there's also a PRP for face. Is it painful? Can you tell us a little bit about it?
Sure. So PRP is basically a blood draw where you take anywhere from 10 to 50 cc's or mLs of blood, depending on the kit that you're using and the centrifuge machine. You take the blood, you spin it down in a special machine, so you separate out the red components of the blood from the plasma and the platelets. And then you take the plasma with the platelets, you draw it into a syringe, and basically you can inject it, or what some people do, especially for the face, is that they microneedle, and then they'll sort of put the droplets on the face. I don't prefer that technique because the studies show that an injectable form of the PRP is more effective than just kind of laying it on the skin. So everyone thinks back to like Kim Kardashian with the vampire facial. Yeah, and that one is the kind of that topical application, and it just, the thought there is that you're creating these little microchannels with the microneedling, and that hopefully once you put the PRP on the skin, it sort of absorbs into these pores. But the truth is that as soon as you make the little poke with the microneedling, it already fills up with blood. Like the blood just coagulates, and it kind of blocks that channel. So the actual research on it has not been very good. So it has not been shown to be too effective, and so injections of the PRP underneath the kind of most superficial layer of skin is definitely more effective, and that doesn't necessarily have to be coupled with microneedling, especially not in the same session because you're going deeper. It can be, but it can also just be injected separately. For the scalp, PRP has had very good data to back it up, like randomized controlled studies. So overall, data is stronger for scalp than for face. But if you're going to do face PRP, I would recommend the injections over just the drizzling on the skin and praying that it gets absorbed. I just think that you're leaving too much to chance.
Right.
And so that's kind of how I view it.
And how long in between, let's say you got PRP today, when would you have to come back to get another treatment?
Depends on the strength of the kit. The one that I use is usually good for anywhere from 4 to 6 months. So you're looking at about 2 to 3 treatments a year for proper maintenance. And so what it's doing essentially is that you have the platelets that you're re-injecting into the face, and once they're activated, quote unquote, which is like basically what that means is that it's releasing, the platelets open up and they release growth factors. And those growth factors are creating some regeneration in the area where they're working. So the growth factors have a finite, lifespan. And so in most cases, it's about, say, 4 to 6 months.
I see. Yeah, that's 4 to 6 months to come back. It's very interesting. We're also going to be taking questions from doctors' followers. But I just wanted to come back to, before we take the questions, how are hairs removed for transplants?
That's a great question. So we use this latest system called the WOW, W-A-W. And what it is, it's an actual oscillating punch, which is really cool because most of the punches that are out there, right, because you have a hair that's sticking out and you have some skin that you want to take with it, with a little bit of fat as well. That's kind of the unit. And how are you going to take that out? So there are sharp punches, which literally on the end of the punch, it's a sharp end. Mm-hmm. So as you go in and you try to punch that hair out, what you can sometimes do is it's called transection of the graft. So if the hair is growing out like this, mm-hmm. the bulb, say, is right here at the base.
Right.
So you want to get the bulb out, and because when you move it to the new place, if you just have the shaft mm-hmm. and not the bulb, then the hair's not going to grow back. So what we use is what's called a blunt oscillating punch. So you go over the shaft and it basically creates its own oscillating energy, mm-hmm. and it's a less traumatic way to get the hair out. So our risk of transection, which means cutting through the hair and making it not usable, is very low. And so that's our preferred technique. So it's an automatic type of machine that you hold in your hand, mm-hmm. and that's how we get each hair out one by one. For the most part, gone are the days where we're using an entire strip of hair, mm-hmm. which is a little bit of an old school technique. Occasionally still employed, has some utility, but rare, especially for men. We usually don't do that because if they want to wear their hair short, you don't want to see that linear scar. So by the one-by-one technique, using very, very small punches mm-hmm. on the order of 0.8, 0.9 millimeters, we're able to create basically a scarless appearance to the back of the head.
Now, can you transplant from anywhere other than the scalp?
You can. You can get hairs from other places. So mm-hmm. most commonly, if, say, the patient is depleted in the scalp area, we'll go next to the neck. Especially for guys, they don't really mind if we take that hair. So that's a fairly good source. And the next option after that would be mm-hmm. chest and back. But for our female patients, it's really always the scalp.
And how are the eyebrow transplants done?
So for eyebrows, we'll frequently take a strip from the back. It's a small strip because we don't need as many grafts as filling the rest of the head.
Sure.
And when you take the strip, what that allows you to do is to separate the hairs into individual strands, as opposed to when you're taking a punch, a lot of times the hairs grow in sets of 2 or 3 or sometimes 4. So for the eyebrows, you want a lot of one single hair grafts. And when you have a strip, you can, under the microscope, cut them down into single ones. And so that's actually one of the main benefits of taking a strip instead of the one-by-one technique. Again, a more advanced concept and one that even a lot of our patients don't really understand. A lot of doctors who do hair don't really get, but that's, in our practice, a very important concept. And then once you have all the hairs and they're separated out, then basically we make what's called recipient sites. Mm-hmm. You have to create a little slit where the new hair will go after the hair has been numbed up with some local anesthetic. And then we place the hairs one by one. And on average, we're doing about 150 to 350 hairs per side, depending on how deficient people are in the eyebrow area. And it's very meticulous, and it's very important to follow the correct growth patterns of the hairs, because you don't want the hairs growing out.
Absolutely.
Coming right out at people.
This is permanent, unlike microblading. Microblading is, I'm sure you've heard of it.
Yes, of course, yeah.
It's such a different
it's very different.
And temporary.
And temporary, and what the transplants create is that three-dimensionality they otherwise can't really create. So it's a neat procedure.
So I want to make sure people know where they could find you and keep in touch with you in your practice before we take questions. Sure. Where can people find you? How can they get a hold of you?
So the best way is really to just check out the website. It's cityfacialplastics.com. They can also, I mean, literally, if they just Google my name, that's the first thing that pops up, Gary Linkov, Linkov. I have an Instagram that's fairly developed. It's Dr. like Dr. Dr. Gary NYC. That's another way. And I have a phone number for the practice, which is 929-377-7869, which is also on the website. My photo galleries are all online, and those are the best ways to get in touch. The email is also on the website, so if they want to send a question in or book an appointment even, that's all available through the website.
Fantastic. So we do have a question from one of your followers on Instagram, and the question is, what is your most requested procedure?
So in my practice currently, it's definitely the lip lift. I have patients finding me from around the world, honestly. I've operated on patients from England, from Canada, and other states outside of New York. So that's become definitely one of my most popular procedures.
Fantastic. And we have some more. The questions are, this is a new format. So, has the new Botox passed for FDA guidelines?
Oh yes, the new Botox, great question. It's FDA approved, but it's FDA approved only for the glabella, which is the area right in between the eyebrows that some people call the 11s. So that's the only site where it's approved, but I can tell you I've already used it on the forehead and the crow's feet, which is some of the most, other very common areas to inject the neurotoxin, and it's worked beautifully. So haven't had any issues with it. So like most things, especially filler, there are plenty of off-label applications that people use filler for, as well as different types of neuromodulators. So, but the official FDA clearance for Jeuveau is for glabella.
Okay, and someone wanted to know also, repeat the name of Botox, the name.
Oh, the new one? It's Jeuveau.
Jeuveau.
Jeuveau, yeah, and
So
the company
Jeuveau.
is Evolus, EVOLUS. Yeah.
And do you know about fibroblast plasma skin tightening?
Fibroblast plasma skin tightening. So I haven't heard of that exact terminology, but as often happens in the aesthetic realm, there are a lot of things that are the same but have different names. So they're most likely what that is a type of PRP from what it sounds. So because there's plasma, because there's fibroblasts even within the PRP, and there's a form of PRP that has a very similar name. So from how it sounds, I think it's something probably just like PRP. But I'd have to research that specifically to give you more information.
Oh, well, do we have any more questions? Well, I actually have done the procedure of Sculptra, and for some of our viewers that are not familiar with the procedure, can you tell us?
Is that 5 minutes?
I didn't.
Or is that? Let's wrap it up. All right, we'll keep going. The sculpture.